My name is Matthew Simonovic. I'm an associate professor at the Save Sight Institute, and I'm a consultant vitreoretinal surgeon at Sydney Eye Hospital and at the Sydney Children's Hospitals. We've been asked the question, how is retinal detachment treated today and what are the surgical options? Well, current treatment of retinal detachment depends both upon the nature of the retinal detachment as well as the preferences of the treating surgeon. I'll be covering the treatment of rhegmatogenous retinal detachment, which is the most common form. And this form of retinal detachment is caused by a tear or break in the retina. If the retinal detachment is limited and hasn't produced any symptoms, then it may be appropriate to perform an external procedure such as laser retinopexy or cryopexy, which is freezing treatment. What does this do? Well, it limits the spread of the retinal detachment by creating a bond between the retina and the underlying layer. If the retinal detachment is more extensive and has produced symptoms, then more invasive procedures are indicated. Pneumatic retinopexy is a procedure which is suitable for a select proportion of cases. In this operation, a gas bubble is injected into the posterior chamber of the eye. It helps press on the retina and reattach it. At the same time, we need to seal the break or tear that has caused the retinal detachment, and this is done either with a freezing probe via cryopexy or with laser after the retina has reattached. Alternatively, we can perform a scleral buckling procedure. I've got a video of one of these, the top right. In a scleral buckling procedure, a silicon element is placed onto the white of the eye, the sclera, and is generally tucked underneath the muscles that move the eye up, down, left, and right. This silicon element is stitched onto the eye so that it deforms the wall of the eye, moving it towards the retina. This helps reattach the retina through changes in fluid dynamics within the eye. At the same time, again, we need to perform retinopexy, that is a sealing procedure to the causative breaks or tears in the retina, and this is done either at the time of placement of the buckle with cryopexy or freezing, or later after the retina has attached with laser. Alternatively, we may perform a micro keyhole operation called a pars plana vitrectomy. I have a video of one of these at the bottom right. In this procedure, small ports are placed within the eye, and we use small instruments, which are the size of small needles, to cut and remove the vitreous gel from inside the eye. This allows us to access the tears that have caused the retinal detachment, and we treat the tears directly with laser or with freezing treatment, and we remove directly the fluid from underneath the retina. After the retina has reattached in the operation, we inject a gas bubble into the eye. Sometimes we may choose to inject oil into the eye. Oil needs to be removed at a later operation, whereas gas is spontaneously reabsorbed by the eye itself. If we have patients who have complex retinal detachments, we may choose to perform a combination of scleral buckling with pars plana vitrectomy.